presentation team is ready.
Yes, Paula, we are ready.
Thank you, Gianluca. And I can see the recording has started, so we are probably fine to go soon. I think the numbers will be growing as we speak. Okay, I think that we can probably start. And even the technology seems to be on our side today. So far, no issues. And I hope that everybody can hear me well and can also later on hear each other's. So good evening or afternoon or morning, everyone in the online event today. So to begin with this webinar, I'm pleased to introduce to you the main elements of UN Habitat's Cities and Pandemics Report Initiative. The context of this report is rather clear, I would dare to say. Over this year, the COVID-19 pandemic has made national and local governments, people and communities to take very strong physical, social and health measures to reduce the spread of the virus and mitigate its impact. We've certainly all been touched by this. And by now, it's also rather clear that the current crisis is emphasizing challenges that we already had, many of them most clearly felt in the urbanized areas. We see the global economy has taken a downturn. Many governance systems are under multiple pressures. That's the topic of our discussion today. And poverty reduction and equality trends are reversed, being a very big blow to the Sustainable Development Goals progress, something very serious that we all should be concerned about. And some of the common uses of and behaviors in urban space are also being challenged and very much changed. And with over 90% of COVID cases occurring in urban areas, we have also seen that the world's cities are becoming the crisis centers, as well as the leaders in the recovery and resilience efforts that are being unfolding the entire year. But as a rare positive thing in all this is that the pandemic is an opportunity for every actor and every person to depart from the past unequal and environmentally destructive path of the pre-2020 world and help bring in a transformative change towards what is now often called the new normal. But the direction of this change needs to be based on proven policies and actions by governments, communities, businesses, and people. And in this context, UN Habitat wants to explore how could the different types of cities help turn the negative trends to positive towards more sustainable development. The purpose of this UN Habitat report on cities and pandemics is to understand the relationship and causalities of cities and pandemics better than what we do at the moment. The report teams of UN Habitat have studied the emerging COVID-19 impacts and ongoing responses with a focus on anticipating and formulating evidence-based policies that urban stakeholders can build action on as we go forward. And we examined 4 central themes for the future of cities: urban morphology, urban economy, inequality, and governance. The first consultation with stakeholders on the report's directions and thematic choices took place in June this year. And now the second stakeholder engagement that we are running, the series of 4 webinars around thematic discussion papers, consults on the report's draft main recommendations. The discussion papers will, once they are fully finalized based on these webinar consultations, they'll constitute the final full report of recommendations, and this will be out early next year. So the objective of today's webinar on policy, legal and governance responses to COVID-19 is to share the discussion paper with key partners for consultation and gather expert feedback on the strength and validity of the key findings of UN Habitat on this theme. So, to begin the session, let me introduce now the moderator of the event, Mr. Remy Sitcheping. He's the Chief of Policy, Legislation and Governance section of UN Habitat. And Remy will be facilitating the expert panel discussion and the inputs from the audience that will from the experts' inputs. And then in the end, Mr. Eduardo Moreno, Head of UN Habitat's Knowledge and Innovation, will summarize the highlights of the discussion and conclude the discussion. But now, enjoy the discussion, and over to you, Remy, to introduce the panelists and make your own opening remarks. Thank you.
Thank you, Paula. I join you and colleagues to welcome everybody to this, the fourth in the series of these webinars we are organizing in response to COVID in terms of knowledge generation and policy recommendations. So we have, I would say, 3 segments. We're going to give you an idea of what is emerging from what we have looked at so far. So my colleagues Paulius and Gianluca will give a brief presentation on what we have done, and many of you have already seen the full document. And after that, we're going to have 4 presenters to come in to give their perspective from the academic, the professional, and grassroots community. So without further ado, I will ask the duo, Paulius and Gianluca, to take us through some of the things that are emerging from the paper, just to give you an idea of what we'll be discussing later on. So Paulius, Gianluca, over to you. If you can keep it to 15 minutes, please.
Yeah, good morning, afternoon, everyone. I'm trying to get the control of the slides so that I could be moving them. Right, do they move? Hey. Yes. Okay, let me very briefly run through the introduction. We decided that we are going to look at the current approaches and measures of tackling the pandemic and see if any of them are new. And of course, there is nothing new under the sun, and many of the measures have been tried before, some of them hundreds, if not thousands of years ago. And even the fiscal measures that so prominently feature in the current approaches have been already tried during the first epidemic of SARS in Asia Pacific in 2003. Wow, that moves too fast. Okay, so the central questions that we addressed, or we wanted to address, is how the governance institutions and systems are responding and managing the crisis, what types of policies have been enacted and implemented in this nexus of state, market, and society. We had a bit of ambition to understand what had worked and why, and how to measure success. Don't see where, okay. So, in a little bit more specific way to the governance, we wanted to see what was the situation of distributing responsibilities among national, subnational governments, and what mechanisms of coordination existed among those levels. How was the distribution of responsibilities and coordination affected in responses to the crisis, and what is the likely medium and long-term effect to distribution of these responsibilities. Now, of course, the departure point is that just months before the pandemic hit, there were 2 important reports published. One of them is the report on global health security in October 2019. Another one was a World at Risk, our own UN report commissioned by Secretary General, which is published annually on global preparedness for health emergencies. Both of them have made devastating conclusions. The report on global health security stated that the health security is fundamentally weak around the world, and no country is prepared, and every country has important gaps to address. And when the Foreign Policy magazine introduced the annual report of the World at Risk, they had a headline that today looks sort of prophetic. They said that the world knows an apocalyptic pandemic is coming, but nobody is interested in doing anything about that. And mark it, it's September 2019. Now, once the pandemic hit, we look at the approaches and means, and of course the major objective has been to contain the spread of the disease. And the traditional means that you could also see in the history of the overview that we have done is to limit the freedoms of movement, assembly, and conducting business. Apparently, it has consequences on economy, in turn inevitably decreasing business opportunities, and primarily for some sectors of services. There were additional measures trying to preclude these strong limitations, such as, keeping physical distance, wearing protective masks and gloves, disinfect hands and surfaces, and so on and so forth. But up till now, no clear scientific consensus emerged whether any of those measures have been effective to restrict transmission of the virus. What seems to have worked universally are the lockdowns, the extent of extensive testing and tracing of the past contacts. Now, when we look at severity of the restrictive measures and try to think whether this is justifiable, we would need somehow to measure, one, the degree by which COVID-19 affects a community, the severity of restrictions introduced by authorities, and the effect of those restrictions on economies. We should also look at the reactive development of prevention and responsive measures over time. So we have tried to run through a quick exercise to see whether there are correlations, and you saw that in the text, looking at classification of health systems, because the countries have different health systems, types of governance, preparedness to pandemic, impact on health and deaths, stringency of restrictions, and the economic decline course. And without going into detail, I'll say no widely applicable correlations were found. Even the countries that were supposed to be very well prepared had to introduce very stringent restrictions, and the stringency of restrictions did not lead to the great decline that has been forecasted. You can find that all in the text. I will not stop much on this. And before I pass on to Gianluca, I think that there was sorry? What happened to the presentation? Did I do something? Okay. So we have looked at different work done by other institutions, and we found that the OECD policy notes, of which there are several that are described in the text, have very important takeaways at the outset of the work that we wanted to do. One is that, that there was a territorial diversity of severity of the crisis, and it required different and multifaceted governance responses. Of course, the vulnerable groups, and especially where they were concentrated, required special attention and targeted measures. All levels of governments have a role in response, and of course these roles may differ in different circumstances, but vertical coordination and also the cross-jurisdictional territorial collaboration seem to have been essential to effectiveness. So there have been ad hoc coordination measures, and the existing arrangements need to be adapted. Some temporary governance structures emerged, and efficiency required also to increase the flexibility of the mandate of the subnational authorities. Yes, preparedness and resilience were important, but only to a degree. Participation of subnational levels has also had its own importance in the effectiveness of response, but yet it depended very much on administrative, fiscal, and technical capacity at subnational level. Finally, rich, accessible, and well-managed data and efficient communication across the levels and territories were very important to policy development and monitoring of the effectiveness and adjusting the response. So that was sort of departure points of the work that we were bound to do. And from here, I would pass on to my colleague Gianluca Crispi, who will introduce the work and the results of the work having been done. Thank you. Gianluca, the floor is yours.
Thank you, Paulus. Hello, good evening, good morning, good afternoon. I'm Gianluca Crispi, and I will take you through some of the analysis we did for the chapter on cities and pandemic. The main effort of our work was to analyze all the governance, policy, and response and legal measures that cities have introduced in the last 10 months in response to the pandemic, to understand better which governance measures have been introduced by which level of governments, and to understand better the level of the effectiveness and the main trends. With a small team of our colleagues, we have analyzed close to 200 policy governance and legal measures from 83 countries. And we have tried to categorize all those measures around some categories. The categories are the policies, legal measures, and actions that have been designed and implemented by cities in collaboration with other levels of governments, in collaboration with other local governments, without support and coordination, or even in conflicts with other tiers of governments. We have classified also policies and legal measures that have been defined at national level and cities had to implement without any particular involvement. And lastly, we have analyzed and categorized all the governance mechanisms that have been used by cities to manage and to respond to the crisis. Starting from the main policy areas where collaboration there has been between levels of government, the main policy areas are all the areas around health and epidemic management. This is one of the areas where there's been collaboration across levels of governments, as well as around all those policies around social protection and support to vulnerable population, and economic recovery policies. Cities have also designed and implemented a number of policies in collaboration with neighboring cities, regions, and municipalities, part of the same metropolitan areas, like economic and social support measures, and also to ensure the continuity of public services like such as transport and waste collection. For example, in Mexico City capital government coordinated with the municipalities, part of the metropolitan areas, to implement initiatives to support families and micro enterprises during the pandemic. Lastly, in some cities, in some countries, cities have designed and implemented policies without coordination with other levels of government. And this was more common in the first waves of the pandemic. We have seen that as time passes, cities and countries are learning, improving, and setting in place a better coordination mechanism for their policy design and implementation. Going to the cities that have been developed by cities without coordinating with the other levels of government, the main policy areas are those mainly in the first wave was the immediate response to the pandemic. Certain cities were faster than national government in realizing the importance of acting and putting in place response measures. So in several cases, measures introduced by cities at local level were then scaled up at national level and extended to all countries. Obviously, since local governments are so close to citizens and people, cities were very active in introducing measures to support socio-economic development of their populations, especially cities with higher income countries introduce more local business and economic development, economic recovery packages. And an emerging trend in the last months is the emergence of, at city level, of long-term recovery planning, especially in high-income cities in high-income countries are starting developing strategies to live rethinking life with COVID and also planning how to build better for a more resilient future. For example, Melbourne has recently published and developed the COVID-19 reactivation and recovery plan, or Milan with its 2020 adaptation strategy. In some cases, cities have also adopted policies and regulations in conflict with measures adopted at national level. And this was particularly common in federal and decentralized countries. Federal states such as US, Brazil, Mexico, and Germany have all had conflicts between levels of government. We think most likely because in federal states, subnational governments are used to enjoy a certain degree of freedom and the responsibilities that were less likely to accept over-imposed actions from the federal governments. Also in highly decentralized countries, conflicts between levels of governments were particularly common. I can also mention the in this regard the example of Madrid, where the highest regional court cancelled a lockdown imposed by the Spanish central government. And in response to that, the Spanish central government imposed a state of emergency to supersede the local ordinance and impose the lockdown. But also regardless of the form of states, we have seen that in many instances, conflicts were also the resultant of the fragmentation of the political systems, and where different levels of governments were managed by different political parties. COVID-19 response measures were used as a means of internal political fight. And in some other countries, the conflicts were the resultants of nationwide measures that were not responding to the actual territorial needs of regions and cities. Looking at the policy and measures that were implemented by, that were developed at national levels, where cities have had only an implementation role, we have identified three main categories. One is the containment measures. So in many countries, following the adoption of a state of emergencies, restrictive measures have been introduced, and local governments had only the responsibility of implementing them. The second categories again are all the measures to support and to cushion vulnerable population, and now recently the forward-looking strategies for the future and for the economic recovery. We also looked at the governance mechanisms that have been used by cities in managing and responding to the crisis. We have two main categories: cities that have been using pre-existing COVID governance mechanisms, so institutional structure and practices, governance practices that were pre-existing the COVID pandemic. In particular, those institutionalized bodies were existing before, and they were meant to facilitate vertical and horizontal collaboration. I can mention the Council of Governors in Kenya, the Spanish Federation of Cities and Provinces, of the permanent state region conferences in Italy. Those institutions were already in place, and they were and have been used. In addition to that, they were extremely useful in certain countries, those local administrative structures that have been established in response to previous emergencies. This included structure that had been established for the Ebola virus crisis, especially in African countries, and the 2002-2004 SARS outbreak in Asia. Those countries that had experienced those health emergencies had set in place institutional structure that were used even for the COVID response, but also structure established for a disaster response were particularly useful. For example, in the United States, Chicago utilized experience gained while addressing a severe heat wave in 1995 to build strategies for the response and to protect vulnerable residents. While governance institutions played a huge role, also existing governance practices were extremely relevant and have been used. In addition to the pre-existing mechanism, many cities established new governance mechanisms, and this took the form of special task forces. Some of them were broad in scope and content, some had a specific mandate or mission, for example, economic resilience or health task forces. Another new mechanism that have been introduced by cities in response is the introduction of digital services and tools to respond to a number of needs, including to track and stop the spread of the virus, to promote more effective communication and to communicate effective information with the citizens, to ensure the continuity and the delivery of services and avoid disruption, to ensure that local institutions can still meet and continue with their democratic function. For example, in the Netherlands and in Spain, local representatives may deliberate and take legally binding decisions through online sessions, for example, or also to enhance the involvement of the population in decision-making processes through online means. In addition to that, there have also been new governance creations to facilitate the involvement of communities and non-state actors. I'll move quickly to some of the findings and lessons we have identified provisionally with our analysis. We can say that we have been witnessing to a rebalancing of powers among levels of governments to address the COVID-19 crisis. In some countries, this was the result of national government that failed to respond quickly and that favored the increased influence of subnational governments that took the place and the lead. In some countries, cities received additional powers by the national governments to deal with the emergencies. In some other countries, the opposite happened. that functions that were competencies of subnational governments have been temporarily re-centralized at the national level. At this stage, it's difficult to predict if this change in power functions and sphere of influence will have long-lasting effects or not, but we believe it's important to reflect, and it could be one of the trends that could shape governance at subnational level in the future. And, another lessons of the COVID pandemic is that is the importance of territorial and spatial governance approaches to achieve more effective measures, to reduce the detrimental impacts, to reduce conflicts between levels of governments, and to ensure better compliance by people. And this we believe is one of the lessons that cities and countries have learned. While in the first wave or in the first months of policy responses, there were many countries that were imposing nationwide policy measures. As time passed, more and more countries are introducing territorially specific measures that take into account local needs, conditions, and local capacities. And then another issue that is worth reflecting is the, and we believe is one of the lessons of the COVID-19 pandemic, is the central role that an effective, responsible, and capable public sector has in responding and dealing with crisis. We can all agree that national and local governments have played a fundamental role in managing the crisis and in mitigating the pandemic effects. Yet the capacities of local governments to do this vary greatly and may be inadequate after decades of underfunding, reducing investing in staffing and in social spending, and increased outsourcing of service delivery. The need to reassert the essential role of the public sector could be important in dealing with the future emergencies that we will all have to deal with in future, including inequalities, climate change, or other epidemics. It is important to, another lesson is that it is important to learn from a crisis to build institutions and governance to deal with the future crisis. And then we can also make, there are obvious findings, but we found the evidence that is indispensable for effective response to have in place coordination mechanism and decision-making bodies that are multi-stakeholders, multi-level in essence. The COVID-19 crisis has also reaffirmed the importance of transparent, accountable, and trusted institutions. Trust and transparency are essential elements to foster population compliance with the measures adopted to address the pandemic. As Paulus mentioned, testing matters and is fundamentals, but only if people agree to be tested. Tracing has been fundamental, but only if people pick up their phone and they're willing to collaborate with public authorities. Social distancing and lockdowns work only if people agree to sacrifice some of their personal freedom for the good of others. So one of the key issues and findings that transparency, accountability, and trust in public institutions is a key element for success in policy measures. We also recorded the acceleration, the digital transformation in local governments, local governance has had in the past months. This was already ongoing. It was an ongoing trend, but we believe, from the policy measures we have identified, that in the past 10 months, e-government solutions have been moving ahead with at a fast pace. And lastly, with the re-emergence of both at city level, at the national level, of local economic and restarting strategies, there is the need to change the common development visions to build that better. I will pass over now to the experts for their reactions. Thank you for your attention. Over to you, Remy.
Thank you, Paulius. Thank you, Gianluca, for giving us a bit of insight of what is emerging. As you know, this crisis is a moving target. Things are evolving every day. We don't know what the implications of maybe mass vaccination will be, and if some of the measures will be continue or discontinue. But still, it's good to be tracking this. Now, I would like to move to the session where we're going to get colleagues from professional academia and the grassroots, 4 of them, to give us their perspective between 5 and 7 minutes. And we'll start with Nicolas Gabi, who, from the government area, City of Madrid. We're going to post his full bio in the chat, so you have the luxury to read through in a minute as he load. I don't think he has a presentation, but before he gets ready to take the floor, Nicolas is a principal advisor of international affairs at Madrid City Council, in charge of strategic advisory in urban diplomacy and economic, and he coordinates the work on 2030 agenda, localization, coordination with the EU affairs, and among others. So, Nicolas, if you have 5-7 minutes, not only to reflect on some of the things that we have found, but also your perspective from Madrid. Please, you have the floor.
Okay, thank you very much, Remy. Can you hear me well?
Yes, we can. Go ahead, and we can see you.
Fine. Very good. No, because there's some technical problem. So I will try even to be a little bit more brief, because maybe it will be good also to have some dynamics with the other panelists. It would be also of my interest. So first of all, just to congratulate you for the great work. I mean, the chapter it's extremely comprehensive and well developed. The presentation that Paulius and Gianluca did, I mean, is really touching a lot of important elements that I would like to develop. But I will try to just focus maybe on a couple of aspects that maybe I could be, let's say, more highlighted, in the document, or that can maybe be, let's say, some hints for a forward thinking about what we could do after. So first of all, let's say the Madrid, starting from the Madrid experience, and underlining that Madrid is a city in Spain and in the European Union, because I think that this is a dramatic difference, the fact of being a local government within the European Union, because it radically changes the situation and makes also, let's say, the uniqueness of the European Union situation, for bad and for good, of course. So I would like to outline maybe 2 simple aspects. One is the fact that, of course, we know this pandemic crisis just accelerated processes and highlighted already existing discrepancies or policy or positive aspects. So taking just one example of each, I would say that in terms of dysfunctionalities, in the Madrid experience, I mean, the clear issue and the most evident and even, let's say, tense, it's what already Gianluca referred to, that is this tension and even, let's say, conflict that has been created due to the uncertainty of the legal framework that regulates the decentralization process in Spain. This affects Spain, but it also affects other countries like Italy, where the decentralization process is a very complex and cultural political issue since years. And of course, there is so much work to do yet. So this crisis really outlined and some urgent issues to be solved. So in the case, the legal framework that is the basis, as we know, showed a lot of fragility. It's true that I mean, and just for you to have an idea, Madrid is quite particular because it's within a region called Madrid that in reality corresponds to the metro area of Madrid, but is a region. And the regions have the health competence as well as, by the way, the employment competence in Spain. So health is regionalized; it's not national competence, as well as, by the way, in Italy. So in this case, we arrived to situations like the one of 5 days ago that Gianluca mentioned. The fact that, I mean, in Madrid, we have, in the region, we have a posture. In other regions, by the way, we have other postures. So we have as many postures as regions in Spain. And the incapacity, probably, and this is also a political incapacity, I must say, to compensate the legal uncertainty, to let's say try to find an agreement, a political agreement to compensate the legal uncertainty was not possible, and so the state, in order to coordinate effectively the different measures, especially in this critical moment that are holidays, had to impose the emergency state. This is something that, of course, from an institutional point of view, it's extremely difficult to accept and really needs to be reflected on. At the same time, also shows that politically it seems that there are not so much the condition to reform this legal framework. So it's an interesting point, even if a little bit, let's say, scary, I must say. On this, maybe just to add another point that was also mentioned by Gianluca on the different type of dispositive of coordination that exists in Spain. It's true, we have a kind of conference of regions that was a kind of interlocutor to the state, but in reality it was not really working so far, because unfortunately the logics are more, let's say, political than in terms of let's say ownership of the level of governance, if I might say. And the same applied to the Federation of Municipalities and Provinces, that by the way lived a profound political crisis during the pandemic, because not all the mayors were found reflected their position in the position of the federation, and so also there we saw the weakness of this institution. So I mean, this is quite important dysfunctionalities that we have in the multi-level governance system of Spain. At the same time, these dysfunctionalities exist because there is a real will of have a healthy decentralization process. It takes years, and especially it needs a political context that goes towards dialogue, and it is not always easy in this historical moment. Now, coming to positive aspects, of course, we have a lot, but just especially in terms of community and grassroots and really the way in which citizens operate. And plus, I must say, also the international cooperation, the city diplomacy. I mean, the cities have been extremely solid. They've been working with a spirit of solidarity that demonstrated that solidarity most of time works better beyond the borders and not within borders. No, so it has been really wonderful to work in a city in this moment. But something more concrete that can also be applied and interesting for others is the fact that in Madrid we have, but in Spain in general, the health system has a kind of a big attention to the scale of proximity. So means that we have territorial health centers. So these territorial health centers do not respond directly maybe to the region that has the company, but they are also settled together with the municipality. It makes that the citizens have a district health center. And this has been extremely effective, not just in terms of the perception of the citizen, in terms of having the institution close to them, also in terms of response, but also very practically in terms of being able to monitor as Gianluca was saying, that is a key issue, to monitor the pandemic itself. So this health structure at the territorial scale, focusing on the proximity of the service, has been extremely effective. And in a moment, just talking about a few years before the pandemic, in which this system were pretty much questioned, I think that this pandemic crisis, put this structure in another light. Maybe they can be, it's a little bit expensive to have them, or maybe not. I think it demonstrated in Spain, and also I would say in Italy where they work, the validity of having such structure at the appropriate scale. Now, the general consideration I wanted to make for the chapter is the following.
1 minute, if you can, yeah.
Yeah, pardon. 2 minutes. How many? Pardon. How many minutes I have? Sorry.
1 or 2. 1 or 2.
Okay. Okay. So very quickly, it's true that everything happens in cities, and the cities are on the front. At the same time, these do not have to be, let's say, mixed with the reality that is, I mean, with the issue of competencies. What is crucial, of course, is the coordination. It was already said, but a couple of principles I think could be inserted in the chapter are the principle of subsidiarity and proportionality. I mean, to apply policies also by a reason of scale and the effects that the proposed action wants to achieve. So this is a principle, subsidiarity and proportionality, I repeat, that we apply in the European Union context, and that has been extremely effective to manage such a complex structure with such different territories. So I think this is extremely important. So I really insist on this point. So to have to reason with the scale and the effect of the action depending on the capacity to deliver, depending on the level. And this is something that really substantiates the multi-level governance process. So this principle. And then the other aspect that maybe could be added in the chapter is not just to focus on the governance of the immediate response to the crisis, but also the governance of how we will be rebuilt, so the governance of the reconstruction. Because actually nowadays, also for cities, the real issue is how we will get the resources, what kind of tools we will have, and which competencies. So I think that this is also another aspect that is crucial to say. Voilà, thank you.
Thank you very much, Gavi, for this sharing that experience and giving us 3 important messages or areas to look into to advance with the project. I mean, this chapter in particular, and it fits very much in the context of the governance and some of the instruments, the policies, regulations, and this element of subsidiarity, proportionality, and the governance of the future, the rebuilding. So that's very pertinent. Thanks a lot. I would like now to invite Mr. Nuno da Cruz, who is Assistant Professor Research Fellow at London School of Economics, Cities in London. So we're going to post his bio in the chat in a minute. While he's getting ready for 5-7 minutes interaction, I would like to invite you to start posting your reflection experience on the chat bar. Colleagues, we collect that so that you can go into the second round that will come in a few minutes. So, Dr. Da Cruz, are you ready?
I'm ready.
Okay, please go ahead.
Hello, everyone. Can you hear me well and see me? Hopefully everything
you can
is
hear and see you clearly. Go ahead.
Excellent. Thank you very much. So, the usual good morning and good afternoon and good evening to everyone, depending on where in the globe you were watching this. Thank you very much for the invitation to contribute to this webinar and to provide feedback on this really interesting chapter. I also follow my colleague Nicola on congratulating your efforts in putting this together in such a short amount of time. Like Remy was just saying, I'm an assistant professorial research fellow at LSE Cities, and at this moment we are together with UCLG and Metropolis promoting this project called the Emergency Governance Initiative. And so this is very much in line with this chapter, which is being discussed today here. We, as Paulius were saying, we didn't have any kind of prophetic capacities and skills when we were thinking about this about a year ago, before this global pandemic was a reality. Honestly, when we were thinking about this idea of emergency governance and what does it mean to jump from emergency to emergency for our democracies, for the way our cities are governed, we were very much thinking about the climate emergency. So this emergency governance initiative that we are currently pursuing is not just about this global health emergency that we are facing right now, but it's also to take into account these developments in terms of climate, in terms of other social emergencies like the global housing crisis that many have been also discussing throughout around the globe. So, but very quickly, I would also invite you to check. We've been publishing regularly on this initiative. We have already 2 policy briefs and a few analytics notes, and we'll be publishing more very shortly. Specifically on this chapter, I've already congratulated the work, but I would like to start by saying that it also proves that helps sustaining this idea that the subnational scale of analysis is indeed the right scale of analysis also for this issue. It allows us to have a level of nuance and a level of sophistication that country level analysis won't allow us to grasp. So lots of dynamics and lots of phenomena and insights will be hidden if we just look at the nation scale. So this is very much a territorial problem that has very different territorial implications. Often, these pandemics, as many other issues, don't care about administrative borders, and to be fair, where people live and play also and work also don't follow these administrative restrictions very often. But so the subnational analysis is the right scale of analysis, and then looking into policy innovations and policy interventions together with legal changes and reforms and governance makes a lot of sense. But I felt in this chapter there's obviously the usual issue with the difference between governance and government. It is very much about government, what is being discussed in this chapter, and I don't think that's necessarily a problem. I do think that, and it has been also one of the principles in one of the papers that we've published recently. The government, the public sector, needs to be very much at the driving seat when it comes to facing emergencies such as this one. But there are certain insights that we are already slowly trying to collect on the issue of governance. So there was this very recently this paper published called "Institutions and the Uneven Geography of the First Wave of the COVID-19 Pandemic," where yes, there is this idea of large and connected regions and colder and drier climates and higher pollution. All of these things helped in making the crisis worse in lots of cities. But there was also some findings on the weak or the declining capacity of formal institutions at the national and at the local government level. And also not just the formal institutions, but also the informal institutions. So the capacity to bridge within or across social groupings was confirmed, at least in Europe, to be very relevant in terms of how bad this pandemic hit certain places. Then Paulie has also mentioned that one of the ambitions for this chapter was trying to take stock of what worked, and even more importantly, why did it work? Also, and how to measure success. That is always very, very difficult when it comes to governance, because transferability of governance models is kind of butts against this kind of idea, basic idea that there's no one size fits all when it comes to governance. But still, we can talk about principles or values and processes and reforms and perceptions and reactions to those reforms and to those interventions that may be informative to other places around the globe. And it's also useful to develop ways of understanding what's happening. So this effort that you are still developing, it's still not concluded, it's one of these contributions. It's how can we understand what's happening on the ground, really, when it comes to governance, when it comes to legal reforms, and when it comes to recentralization and decentralization of powers. How can we even start to go about trying to put some structure in this very complex and abstract field? Well, I think the way that you've organized this in terms of horizontal collaboration and vertical collaboration and so on, it's a way forward. You've also mentioned temporary governance solutions. So I think this is a key element that needs to be explored further. To what extent are some of these solutions temporary? What will go back to normal, and what will stay, or what will not go back to how it used to be after we have, functioning vaccine or this problem goes away? What should go back to normal and what should not go back to how it used to be? These are key issues, and these are also the issues that might be linked to the concerns around democracy and around inclusivity and around legitimacy and so on. So I think including more that aspect of temporality of these reforms and of these interventions would be key. And finally, and I know this is perhaps being overambitious, but I think it's important, and I will make my final comment, is about finance. Because finance is the way that we very often operationalize these ideas around governance. So we need to put the money where our mouth is, and if you really want to operationalize multi-level governance, we really need to put the money on your mouth is when you're operationalizing and concretizing decentralization processes. And this is really ultimately when it comes to funding and financing, whether or not regions and cities have the autonomy to develop their own policies and fund them and help their populations as they see fit, and as it makes sense for the local realities. So finance would be a key element that I would try to strengthen in this report. But like I said, this is a massive amount of work for such a short amount of time, and I congratulate you on the work done so far, and I will be very happy to continue this engagement together because we're working on the same side of the fence. Thank you very much.
Okay, thanks a lot, Dr. De Cruz, for this very informative work and great work that you are doing with many UN Habitat partners. Your points are well taken on the elements of governance versus governance, the informal and formal power balance, and the issue of finance. But my colleague Eduardo will come out later to give you an idea how this is linked to other part of the overall report where finance is also captured. So it's now my honor to move from Europe to Asia to introduce Professor Kundu from the National Institute of Urban Affairs in India, who had led various programs with many international organizations. The bio is in the chat. So she had been involved in this. She attended, I think, and many of you, the first webinar we organized. We are still about 80 here, so let's keep the momentum. Professor Kundu, your reflection from India and on the report, what are some of the gaps and areas we need to strengthen? Over to you, 5-7 minutes. You have the floor.
Thank you, Dr. Remy. Am I audible?
We can hear you, we can see you.
Okay, thank you. Good morning, good afternoon, good evening, participants from wherever you are. Thank you, Dr. Remy and UN Habitat for inviting me for this important event. I'll just briefly touch upon the discussion paper. I think it is well drafted and captures ways in which governance systems, regulations and institutions are responding to the pandemic. The 4 central questions of the paper have been dealt with very meticulously. The paper is not only limited to the analysis of governance at the national level, but also has gone down to the state and the city level governance pattern and highlighted the challenges which have been thrown up by the absence of coordination and cooperation between various levels of governance. And countries across the globe have adopted different policies. Sometimes they were within the same country, like in the case of India, we have subnational governments which have adopted different measures. For example, the state of, in the western part of the country, we have the state of Maharashtra, which focused more on testing initially, but now also it has closed its borders. Kerala focused more on contact tracing, whereas Delhi was more focused on creation of containment zones and more on surveillance. I think all these aspects very well in suggestions. Very briefly, I think there could be a section on good practices, maybe some boxes like the governance strategies undertaken by countries like Taiwan or New Zealand, Singapore for that matter, which have been very successful in containing the spread of the virus, either by contact tracing or really building its health facilities before the pandemic struck, or by containment zones or tightening of borders. That could be one. Again, a section on, because I found that 11-12 pages have been are there on the initial pages on the history of governance. So a section on also how the policies of globalization and austerity measures adopted by the developed countries has slackened the health expenditure and made health facilities more inaccessible for the poor and vulnerable. I think a short section on that. And also, as you mentioned, there's a separate chapter on finance. So I thought it would be important to see national and subnational governments are really having plans to boost the economy and tackle the crisis during this period. I think that would be an important intervention in the report. And also, when we take the case of India, I think there's a need to revisit the 74th Constitutional Amendment Act, because as per that act, we really need to work on the principle of subsidiarity, giving more powers to the local governments in terms of funds, functions, and functionaries. And health is one of the key aspects which over the last 30 years we have ignored. I think it's time now that the local governments really understand and start delivering on this health aspect. And also there could be a discussion on how health infrastructure has expanded rapidly during this time in most of the developing countries, and where a shortage of supply of medical professionals and healthcare workers were already historically experienced, and now we see how critical it is. And the issue of large-scale reverse migration due to the imposition of restrictions on economic activities is somehow missing in the section on page 22, which talks about cities adopt social support measures to protect the vulnerable populations. There is something positive happening in the cities, but the cities were not able to really cater to the population, because of which I think a lot of the vulnerable had to leave the cities, and if you take the example of India, I think millions of people had to go back on foot. So that is one area which could be covered. And again, the conflict between the federal and the state governments and private healthcare facilities in securing health services only for treatment of COVID-infected patients and the subsequent effect on the treatment of patients who were suffering from other diseases is not captured. The role of judiciary in conflict resolution between several tiers of government, what we see in the case of India, I think that could give useful insights for better coordination in the future. And except for a few big cities, action on COVID was limited in the small towns only to managing the subsidiary facilities. And residents of small towns have been left with no choice of testing, forget about treatment. I think that is one important area that our analysis on testing and treatment across size classes could help in understanding the governance mechanisms for pandemic preparedness in the future. And in page 7, where you have discussed there's a figure on economic decline in the second quarter of 2020. There, Asian countries like China and India are missing. I think it would be important to have those countries in that figure, because these countries do have high share of population and also the incidence of COVID patients. And last but not the least, I think data-driven governance, some focus on that is needed, because many countries do not have a robust system of data capturing. I think that would really be the way forward for future resilience building. And I leave it here, and I'll be happy to contribute in any manner in future. Thank you so much for this opportunity.
Thank you very much, Professor Kundu. I would perhaps invite again all the speakers to, if they can, to share their notes or other. We are taking hours, but feel free to share your comments with us. Thanks a lot for bringing again some important points. Again, we're gonna in the end show how it's connected with other segments, bringing the element of migration, maybe in terms of format, how do we put some example or good practices, and the global governance system that we have and the impact on the health. What I like very much is that element of the judiciary that we perhaps should look into, and the impact on their contribution in negotiating between the different levels of governance. And I think the data element we had initially thought through, maybe it's not coming clearly, but we'll look into that. Now, from India, I would like to move to Australia to invite Professor Dustin, who is a professor of urban policy and director of the Centre of Urban Research at the Royal Melbourne Institute of Technology in Melbourne. We're going to post his full bio in the chat so that you can look into that. Professor Dustin Jago, are you able to, I think you have a PowerPoint. Are you able to?
Look, Remy, I do have a PowerPoint, but since my colleagues haven't been presenting, I think I'll just speak from my PowerPoint as notes rather than trying to get it onto the screen in front of us. Probably just delay things.
Okay, great. So, no, that's fine. Go ahead.
First, thank you to the presenters who've already gone before me. It's really informative to hear your thoughts on the chapter. And I would also say thank you, Remy, to you and the team at UN Habitat for putting together this report, and particularly this chapter, because I think it's a really valuable contribution to understanding of responses to the pandemic from an urban perspective. And I realise there's a huge amount of work has gone into it in a very short period of time, and it's actually quite an impressive document, just simply as a record of, or as a catalogue even of the efforts that governments at multiple levels have taken around the world to respond to the pandemic. Look, one thing I thought was particularly noteworthy about Chapter 1 is the fact that it's couched within the context of the history of urban planning, effectively as a modernist kind of policy enterprise, and the connection to public health. I mean, my own research has in the past looked at the kind of the way in which urban planning emerged at the same time as public health movements in the late 19th century, and that many of the practices that developed at least in the early 20th century around urban planning were drawn from concerns about public health. So it's remarkably timely that this report is reflecting on the combination of urban responses to what is effectively a health emergency. So I thought that framing of the report was particularly pertinent and relevant. So thank you for doing that. Look, I think you've done a remarkable job in teasing out some really key themes throughout the report, and especially appreciated the focus on the way in which multiple levels of government interact with each other in various ways. And obviously I've done work around national level urban policy, including with UN Habitat, as you know, Remy, and I think many of the themes within that national urban policy program around coordination between tiers of government are also very relevant to the responses to COVID, including how multi-level governance frameworks have worked, the centrality of an effective public sector, the balancing and distribution of powers and responsibilities between tiers of governments, questions of community input and citizen participation and trusted institutions and so forth, but also the recognition that the materiality, the practice of urban policy, and also in the case of the pandemic, health practices or health management practices, pandemic control practices are happening on the ground. They're location dependent, they're territorialized in cities. So whatever the kind of abstract framing of governance structures is between different levels of government, the actual practicality of the pandemic is a sort of almost a street level experience in many ways in terms of how it's experienced by the population. I guess reflecting from an Australian point of view, many of the themes you've investigated in the chapter are very reflected in the Australian experience of the pandemic. In our policy system, there are quite differentiated roles between the national government, state governments and local governments. So we have a national government that has relatively weak powers when it comes to territorial activity, especially at the urban scale. Our national government can control borders, it has income taxation powers, and it controls major macroeconomic policy settings like interest rates, but it has almost no powers in terms of urban planning, urban affairs, infrastructure, and almost no powers in terms of health management, health control, including pandemic control. About the most it's been able to do is close the borders and then hand out income support payments to the population. Most of the really hands-on activity in managing the pandemic is operated at the state level within the Australian system. And it's you sort of looked at the rebalancing of power amongst levels of government in the report, and in the Australian case, over the last probably 30 years, we've seen a shift towards greater centralisation of power within the federal government, but the pandemic has suddenly unwound that. We've seen a fragmenting of kind of coordinated centralised policy as states have used the fact that they are territorial entities that can bound themselves by closing their own borders, and we haven't seen borders closed within Australia at the state level for many, many decades until the pandemic hit. States have used their territoriality to manage infection control by preventing other citizens from entering the state. They're very strong public health powers under the Public Health Acts that are reasonably uniform across the states to impose lockdowns on populations and all the other kind of control measures. And in Melbourne, I'm not sure if people are aware, but we had a sudden second wave emerge, and we ended up spending over 110 days in our second lockdown. But through the effective capability of the public sector, that's been able to be brought under control. And there was some discussion previously from the presenters about community support, community participation, and a sense of social support, almost at an informal level in response to COVID. One thing we saw in Melbourne was a very, very strong sense of social solidarity around the shared experience of being in an extended lockdown, the shared objective of limiting what we do in order to achieve effectively elimination, as we have done, and a high level of confidence in the public sector at the state level to overcome that second wave that we experienced, which came about in part because of, and something we haven't heard so far in the discussion, and really not so much in the paper, problems in the way that we procure services in the Australian public sector. So in Melbourne, our second wave of the virus came about because security guards employed in very casual, short-term contracts on very low wages were working across multiple quarantine sites and also working in other sectors and other jobs at the same time. And through, I guess, that insecure, precarious kind of employment mode, that was one of the key factors that led to our second wave. So within this interest or this recognition of the importance of governance in the public sector, we also need to recognise some of the risks. And I think now in Australia, there's not just in relation to the pandemic, but in terms of our governance generally, a sudden recognition that some of the market-driven, contract-based, sort of flexible modes of service delivery that we've adopted over the last 20 to 30 years are suddenly becoming very problematic in the context of the pandemic, particularly in the case of flexible, precarious workers moving between jobs, moving between different sectors within the city. At the local scale, we've also seen local governments in Australia very weak, but they've been doing what they can, particularly around local stimulus, establishing parklets in shopping strips, taking road space away that can be used for outdoor dining, putting in rapid response, active travel interventions like bicycle paths, bicycle lanes, and so forth. But really, the powers of local government in the Australian context are not particularly strong. Urban planning, pandemic control is really a state responsibility, even if it's enacted at the metropolitan scale. Look, I think I'll finish it there, Remy. But again, congratulations on the report. I really look forward to seeing the full report when it's completed. It's a huge amount of work that you and your team have done.
All right. Thanks a lot, Professor Dodson, for that reflection on the example, especially the experience from Victoria, Melbourne in Australia, and the suggestions on the areas of improvement in the report. I will just pick a few. This pandemic and the link to job market and the type of contracts, and the element that is also coming strongly, that the social capital that we should perhaps consider in this context of the governance, because we have not paid much attention, that you say the community support and other social support, that so we look very much, I think was mentioned by the crews, by governments, than the community. So these are very much pertinent points that we're going to take forward.
Part of that relates to the trust in institutions, I think, which you've got in the report, but I think that question of social solidarity could be perhaps emphasized a little. So thank you.
Okay, great. Thanks for that advice. Now it's time for those who would like to either contribute 1 minute, 2 minutes contribution, or have a question to some of the speakers, to UN Habitat, to do so. You have, I would say, 2 means. Send that through the chat, or you can raise your hand. You can see what you can pick. In the next, we have about 20 minutes or so to go through this before we wrap up. I'm not sure, colleagues, if there is any particular question. There's a question. Should I read that to you? I'm not sure to who is addressed. How is multi-level governance that many of the speakers have highlighted understood in this report? How do we define it? Is it understood as a mechanism for more effective governance or as an outcome of clearer decentralization or legal frameworks? So I think maybe Gianluca can take this one, or Paulius and other colleagues, other presenters can maybe contribute as well. The second question so far from Melissa Wenmeyer. That was the question from Melissa, sorry. That's what we have now. Any other question? Anyone who wants to raise their hand so that we collect 2 or 3 questions and then have a reflection on that? In the meantime, the presenters, the reviewers can also reflect on what others have said. If they have additional points, they can also do so. So I will just ask, if I don't see anything, I will start with Gianluca and Paulius. And after that, I will, Paulius, go ahead. 1 minute maximum, please. So I can keep time.
That's in response to this question on multi-level governance.
Mm-hmm.
Well, certainly this is a combination of the institutions' responsibilities, but also the ad hoc and coordination, which may also be defined by regulations. So that is how we have tried to position it. Just that what we saw is that any kind of crisis, in this case the health crisis, creates, as our colleagues from OECD noticed, more ad hoc mechanisms and more flexibility. So the question is really whether after crisis, these mechanisms that have been introduced ad hoc will become permanent, or will they roll back? So I hope that answers to your question, but certainly we are looking also at the coordination opportunities as very important element of this. Thank you.
Okay, thanks, Paulius. I will ask Gianluca to maybe if he has additional points before I turn to the presenters to seek also some guidance on a few points.
No, thanks, Remy. I would like to thank all the experts that took place to this discussion for the very useful ideas and suggestions and proposals they make. I mean, I tend to agree with everything they shared, and I will make sure that in the following revisions of the documents we will consider many of those aspects. I'm happy to see that I think there is a need, as it was mentioned by some of the presenters, that they need to understand and to analyze the governance measures taken so far. There are many governance trackers available on the web, but there is a lack of analysis on why certain governments took certain measures and what the outputs was, and if that is linked to a form of government or to an income level of the countries, or part of being a federal, unitary, or part of a metropolitan institution. So I think it's important to understand that there is need and the approach we're following sort of makes sense. I agree that that is important to dwell more on the finance aspects of collaboration and cooperation, because obviously that takes place with more ease when financial measures are attached to decentralization and multi-level mechanisms. So that's a very important point, and we will try to reflect on it and see how to better incorporate it. I also would like to highlight that this is one of the chapters of a broader publication that also covers more policy measures on spatial planning, inequalities, economic and financing. So we have put the emphasis in these chapters not much on the policy itself, but on the way policies are being developed and implemented. So we are less concerned about the content of the policies, but more on how those policies were designed, coordinated, and implemented. There are other chapters that will go into the details of which policies were more appropriate or not to deal with the pandemic. And I will certainly agree with the importance of seeing one is the link between emergency governance and now this and now what we are learning from this year on the years or the months to come will help us structure more efficient governance structure to deal with other emergencies. Most likely the next emergency will not be an epidemic, but will be climate change or other disasters. So it is important to learn as much as possible for the COVID-19 pandemic to help build a governance structure that will make our citizens and countries more resilient to deal with the future crisis. Over to you, Rem.
Thank you, Gianluca, for that clarification. Paulius, do you want to come in again?
No, but I saw that Mr. Gabi was leaving. Maybe we should give them a word if he hasn't left yet.
Yes, the idea to give them the floor, but I would like to guide that discussion of the contribution where we are seeking further input and insight from the reviewers, because one of the things that we grappled with was to understand what the possible trends in the future will look like. If they have, and some ideas to share, that would be good, and also what may stay, what may change. We all recall the 9/11, some of the measures came and then they have stayed. Is there anything that they can see that may stay? And this issue of decentralization, how this experience will, we heard earlier, is going to accelerate or, impact some of the elements of decentralization. Are they seeing this kind of revival of the decentralization in the context of COVID? So now is the reflection to the top for the reviewers. Maybe you can start with Gabi, or who wants to leave, and then we can. Gabi, still there? No? Otherwise, we go by the other, maybe Dr. Da Cruz.
Yes, hi Remy, I'm here. Can you repeat what are the issues that you would like to highlight?
Yeah, we want to understand based on what because this is evolving things. What are the possible trends that may happen in the future, and what are the things that could stick around for long, or some of the things that can phase out, say with the vaccine, or back to build back better, or back to normal. So we're just trying to see if there are some other things we can look from the governance perspective, some of the things that may are likely to be resilient in the future, and the effect of the decentralization, the impact of this health pandemic on decentralization. Is there any insight, anything that you can advise us?
I think. Well, I don't have the crystal ball, and it's difficult to just pull these things out of thin air. I do think that there's the fact what this made was that it was a proof of concept, for instance, on the digitalization of lots of services and of the way we work and the way we've interact and so on, which will have certainly a very large impact on our economies, on the street shopping, on the future of work, and so on, which obviously will have implications also in terms of taxation and the tax base of cities and so on. If most of the times cities rely on property taxes for to fund their activities, and if people all of a sudden don't need to leave as much in cities and so on, and to go about their business, then perhaps income taxing might be another avenue for devolution and decentralization that could be explored. But it's really difficult because we're not past this crisis. We're still in the midst of it. And as I was saying, and as what we're trying to explore in this emergency governance initiative, is that, you know, we might be jumping from this one to the next one. You know, be it the climate emergency, be it the next pandemic, be it, you know, the housing crisis, or, you know, mass migration, ethnic tensions, you name it. So I think what you ask in terms of what will stay and what will go back, and in terms of rebuilding, I think we should think carefully about the changes that were made that we don't want to roll back to the way it used to be. You know, it's you know, it's a tricky space, and I understand that even, for instance, UN Habitat is difficult because it's a space of normative reasoning. You know, it's who has legitimacy to decide these things is a problem. But I don't know if I did a great job avoiding your question, but, you know, if I could predict the future, I would perhaps not be locked up in my flat in London at the moment.
Okay, thanks a lot. Yeah, we just want to see if there are some trends out there that we have missed, or we need to really follow the trend. And I would like now to move to Professor Kundu. Any advice on some of the trends that you see that may be sustained, and the impact on decentralization, and any final thought that you may have?
Thank you. I think we will have more of virtual meetings because this trend has already started. And in India, most of the private companies have already given instructions that even next year the employees will be working from home. So that could be one area more of work from home. And e-governance is being strengthened, not only in case of governance, but also in running offices. Like all this while we were signing papers, now it's all e-maintained. So I think this is a trend of governance which will catch up in future. And as the previous panelists did mention, I think the next, we cannot predict what will come on, but climate emergency is one which is already knocking at our doors, and we really need to gear for this. And the pandemic was one thing which did not distinguish between the rich and the poor. It struck everyone at one go, but when climate emergency strikes us, it will be more detrimental for the have-nots, the vulnerable sections. I think we need to gear ourselves for this section of the population who are already vulnerable, who have been impacted adversely by COVID, and in future they will again be impacted adversely by climate emergency. Those living in the vulnerable locations like floodplains or on hilly tracts which are vulnerable for landslides, and who have very little income, and because of the COVID, many have lost their income, gone back to the cities. And while coming back, I think they will prefer to go back to a small town rather than go back to a city, because when you take the case of India, we find that people have walked for kilometers. Now, while they are coming back, they would like to go to a small town close to their village, so that if such a pandemic arises again, they can go back walking instead of many getting killed or facing a lot of problems on their way back home. I think this is one thing. And also the finances of the small towns need to be strengthened, the governance mechanism and finances, and the government at the higher level should be able to really delegate the powers and responsibilities along with finances, again sticking to the principle of subsidiarity, to the local governments, because everything cannot be determined top down. I think bottom up approach and involving communities and NGOs is again an important step in this direction. I stop here.
Thank you, Professor Kundu. Professor Dodson, can you add anything else on the, what are some of the trends that can be sustained, and the impact on decentralization, and any final thoughts?
Yeah, look, thanks, Remy. Look, some further thoughts I would offer is that we're starting to see governments use sustainability as partly a motivation in addition to the pandemic in terms of the recovery response. In Australia, admittedly in Australia, we're an absolute laggard in terms of energy transition, but we're starting to see state governments, which have responsibility for energy generation, really starting to push a transition to renewable energy generation as part of the stimulus in response to COVID. Another trend we're starting to see is the very, very low cost of debt at the moment at the global scale is enabling governments to borrow to levels that they would not have imagined even past the GFC 10 years ago. And there's now debate amongst economists as to, are we in a completely different economic environment where the cost of debt, the availability of debt is markedly different. And I think that has implications for the way we respond to the pandemic, because if we can borrow cheaply, a lot of infrastructure, other kinds of public sector activity can be undertaken. But I think we also need to be attentive to the social equity consequences and the ways that particular actors within cities may be exploiting the circumstances of the crisis under COVID for their own ends. And in particular, housing markets are going to be a big problem, in part because of that cheap debt. If you've already got a housing asset, you can then leverage off that to take on more debt and buy a second or third or fourth dwelling to increase your wealth, renting it out to people who then, because of the inflation in house prices, can't get onto that initial step of owning their first property. New Zealand is having some serious issues with that at the moment, and I think Australia will start to have these kind of problems as well, and I would expect them to happen elsewhere. I mean, that's just an example of how particular groups might exploit the crisis in unequal ways. And it does point to, I think, the variability and the possible patchiness and unevenness of transformative efforts, and the possibility of rollback of transformation. We might see progressive social interventions in cities over the next year or two. We've already seen some, but are they permanent? Can they be rolled back too easily? And then, look, as an academic, one final comment I would make is the really big problems that COVID has posed for researchers in terms of the continuity of data sets. I work in the transport area, and we've seen travel increasing over the last 20, 30 years, going up fairly steadily. Suddenly we're faced with travel data where there's been a huge decline in urban travel, and we don't know where that's going to go in the future. Is it going to recover to previous levels, and therefore we can just take it as a blip in our data set, or is it actually a new trend that's appeared? And this is not just across, say, travel data but in cities, but it's across a whole raft of data sets. There's a massive discontinuity, and in terms of our ability to project and to calibrate to adjust for that, we actually don't have much to go on in terms of prior experience. So it's creating some uncertainty in the research community as well, which we're going to have to grapple with, and that in turn translates into questions about urban policy. What data do you rely on? How do you interpret data where there has been this massive discontinuity in the trends?
Thanks a lot, Professor Jago, for this. The additional suggestions and contribution from the chat that I can read from Ben Arima, recommending that each level of government should have well-defined roles, responsibility, and strategy based on several criteria, including their functions. So that distribution of role and responsibility within the multi-level governance we have been discussing here is key. I see no further suggestions and comments. I just want to pick a few ideas that emerged from this session. Important element, things to watch out for. I picked the digitalization of services, the continuity in virtual meetings, virtual services, potential impacts that we have to start monitoring, especially in the housing, in the transport, the importance of e-governance that might become a part of our daily thing that may continue. The nexus that we're going to see between health and climate change and energy, as we heard from the case of Australia, the importance, the growing importance we may see on intermediate cities, not only big cities, so we may have to watch out for that. The importance of community and social interactions that we have to really try to factor that in. I also heard these elements of social equity that we should watch out and see if we don't have to roll back some of the gains that we had, and some of the risky behaviors in the, say, the housing, the mortgage sector that may benefit some and disenfranchise others. So we have to watch out and see if we can avoid some of these discrepancies moving forward. And the big one for me had been this data gap. I've not thought about that. Indeed, the way the data have been collected in some sectors, there will be a hole, there will be a gap. How do we manage that? And new ways of data will also come in. How do we start baseline and benchmarking? So these are some of the things that emerge. Can we mute? Oh, yes. Thank you. Okay, good. So I see no further questions. Paulius, you wanted to come in? If while you are thinking, or other
in particular, sorry, I just forgot to mute.
It's okay. So one of the things that I just want to say, but my colleague Raf will come in a minute and maybe cover this, is these elements that moving forward, this chapter, as we heard earlier, is part of the series of other discussion papers, and there be an effort to cross-fertilize to make sure that elements are borrowed, because I heard a lot about financing, housing. There's a dedicated chapter that looks at that, the issue of social interactions and social capital. So there will be an editorial work to streamline all these messages across. Now it's my pleasure to invite the Director of Global Solutions at UN Habitat, Raf Toots, to come in and share his views, perspective, takeaway, and next steps. Raf, the floor is yours.
Thank you, Remy, and thanks to all the participants who have contributed to this webinar. As you know, this is the fourth webinar that we are conducting over the past weeks, and it concludes actually a series of 4, and we are happy that it went well and was very rich in discussion. And also it was well managed in terms of time, Remy, because we have a few minutes to reflect on it, which we didn't have yesterday, which I think is a plus. Let me just first of all thank everyone, and then give a few elements of substantive feedback, and then talk about next steps. So first, let me start with Remy, of course, with the moderator, who's also a contributor, obviously, to the work, for his moderation, to Paulius and Gianluca for the presentation and the work behind, together with the rest of the team, and to Paula, Iris, and Laura for the whole overall coordination of this work on all the 4 chapters, and very much thanks to the 4 speakers. I think they all brought very important dimensions. Nicolas, Nino, Debolina, and Diego to the discussion. I think we are on the right track substantively. That's what I'm hearing. We picked perhaps the right pitch, the right focus, and that was an important decision for all the 4 groups. We could not be comprehensive. We had to pick a number of issues, and I think the right issues were selected, and I see endorsement from our external reviewers by and large, such as the territorial approach to the whole analysis. The focus on horizontal and vertical collaboration, on the distribution of power, on the engagement with citizens, and the issues of subsidiarity and proportionality, which were raised and which I think are reflected also to some extent in the analysis. One of the issues that came up also yesterday very much is the question on temporality of the solutions. What is going to stay with us and what is going to go away, maybe in 6 months' time, and also what are the positive things that we want to stay, and how can we use the momentum that the current reflection is giving to promote these measures to be more permanent, especially in terms of governance solutions and legal provisions and policy measures. Yes, there are lots of connections with the other 3 chapters, and that is very normal. We have seen that in the other groups. And I think this is the richness of the report, that we have touching points, but we are going to try to separate them as much as possible so that the 4 chapters have their own identity, and we will have an introductory chapter with a more generic entry points. But there are touching points, for instance, on finance, as Remy has already said, how will the urban economy fare, through the pandemic, as an impact or impacted by changes in governance systems. It's an important question. The analysis of the spatial scales, both vertical through the different subnational, local and federal systems, but also horizontally in the collaboration between municipalities, for instance, and this comes very strongly through the comments. Also connection with inequality, with housing, which was the topic yesterday, and I think there's some very strong connections, but we are going to make sure that the right focus remains in the four chapters. We also saw in this chapter, and I saw that when reading it a couple of days ago, a very good spread of examples across the world, across all the regions. And I think today's discussion gave some additional emphasis on countries like Australia, India, and Spain, with some deeper insights, which I think going to give some more meaning to some of the analysis, and also some suggestions for filling some data gaps. We also had this very good discussion on the system of cities and the fate of secondary cities when in light of the pandemic. What is going to come next? We are recording as we speak this session, so anyone can go back to the same channel and look back at the recording. We will share the presentation or will be available for anyone to look at, not yet to quote publicly. This is still very much work in progress, but not for long. We hope to conclude this work by the end of January or February into a synthesis report that looks at these 4 dimensions and comes up with sharpened findings and recommendations on behalf of UN Habitat. And of course, we will recognize all the contributors, both external and internal, in the 4 chapters. But that's not where it will end. The report, let's say if it's launched in February, this is just a beginning for us. This will feed into our normative guidance into these 4 areas, because we have communities of practice that are working on these topics, and lessons learned and in living with a pandemic and maybe for future pandemics will be integrated in our normative guidance and in our technical advisory to cities and governments. We will also establish a platform of studies, because we know that if we cut this work at the end of this year or in January, there will still be lots of studies, impact studies, for instance, that will come in the course of next year and beyond. And we are thinking of setting something up that we collect all the studies that have an urban content and that bring more dimensions to light, because the study, you know, is a milestone, is not the end in any way. So I'll leave it here. Thank you so much for your participation, and looking forward to and continue to engage with you in the coming months and towards the launch of this report. And thanks so much, and have a very good rest of your day. Thank you.
Thank you, Rem.
Thank you. Thank you.